So this is what we are constitutionally mandated to accomplish in our legislative session, is to put forward a budget. And at the end of the day, it needs to be a balanced budget in the state of Missouri. So even though the budget was presented to the House a couple of weeks late, and the House was scurrying to get their version of the budget done, it came to the Senate under Senator Brown's leadership, moved to the floor this week after going through the Senate Appropriations Committee. So we worked on the budget on the floor for a few days. And I wanted to provide a few highlights, some concerns I have about that budget. And as you know, I say this often, the budget reflects our priorities, and our priorities as a legislature are the priorities of those people who are in charge. So my colleagues across the aisle for the most part. But one of the Democratic priorities for this legislative session did get passed, and that is full funding of the K-12 budget, the school foundation formula. Now let me step back for a minute and remind you of what full funding means in today's world and environment. Just a couple of years ago, to fully fund the formula, it would have cost us an additional $450 million over what the budget's position on fully funding the formula was in the budget this week. Because the legislature saw that we were not going to be willing to put our money where our mouths were to make good on that promise to our kids, a couple of years ago we took $450 million off the top of what we said was needed to fully fund the formula. In today's world, with this new fully funding definition, we needed to put in about $45 million in the Senate in our budget to get it passed. It was not what the Appropriations Chair and the Appropriations Committee brought forward to the Senate floor, but it was what the senators on the floor decided, as a majority of us voted to put that $45 million into the school foundation formula. So I'm delighted. That position matches the position of the House with regard to the formula, so that position will stick. And we'll see if the governor decides to agree with that position or to remove some money and defund in some way the currently fully funded K-12 foundation formula. Now, higher ed is getting cuts across the board. There are different positions in the House and the Senate. At the end of the day, my request to the budget chair was that if we were going to cut, that we did so fairly across the board and not put some of our public higher ed institutions at a disadvantage over others. There is also language in the bill, in one of our bills. It was moved from House Bill 11 into House Bill 10. And we've talked about this before, that the budget is not a place to put forward legislation. It is a place to put our money so that we can fund what we believe is important. In House Bill 10 now, it used to be in 11, as I said, is language that says that no organization, no doctor, no hospital will get their funding for the low-income patients they serve should they even provide a woman a referral to get an abortion. So, for example, if I went to my primary care physician and learned there through the examination that I was pregnant and that there was going to be a problem with that pregnancy, not a problem that would harm me as the mom, but a problem, and maybe that pregnancy would not result in a healthy child being able to live outside the womb. If my primary care physician referred me to some place where I could access an abortion, then my primary care physician would no longer be able to access state dollars to cover the cost of my health care. And again, when I say I am using me as the person who is the low-income person that accesses the state-funded health care. So that referral language is dangerous because it's so broad. Now we know state dollars do not go for the funding of abortion. So this is not a question about that. This is a question about defunding places like your doctor or Planned Parenthood who actually provide all kinds of health care access to women and to men, including things like cancer screenings for breast cancer, including access to birth control so that we don't have unplanned pregnancies, including STI screenings, including well women and men checkups. So what happens with this bill is it violates the federal law that says low-income people accessing their health care need to be able to go to any willing provider. And I know this is a bit complicated, but this language should not be in the budget bill. While I worked to remove that language, I was not successful, so it remains in the budget bill, and I'm fearful that there will be low-income women who are not able to access the health care they need at the provider that is either most convenient or most desirable to them. The House has removed money through a bill for the circuit breaker, which provides low-income, in this case renters, a tax refund. And the average refund is about $500 a year. The House has taken a position that says we will no longer provide that to our renters. The Senate currently has not passed that legislation. In our budget, we still will be providing, if nothing changes, we will be providing those low-income renters with their annual rebate, if you will, of about $500 per year, a rebate on the property taxes they pay through their rent. And this caused some consternation, I think, on the part of our appropriations chair in the Senate, because he's concerned about how we cover that cost as well as fully funding the formula. He is also concerned about some other support that goes to low-income seniors or seniors with disabilities, some of whom require in-home care or consumer-directed services. It looks presently as if we're going to cut back the dollars available there, which means we're going to cut back services. So when we cut the dollars back to 60% of what they are currently, what it means is somebody who's getting care currently 5 days a week for maybe 2 hours a day in their home, if that's cut back to 60%, maybe they're only getting that care 3 days a week. If that's essential care for them, we don't know where that lands them. Does somebody else have to step in and provide the services they need, or do they end up in a nursing home, which will be paid for by the state at a significantly higher cost to the state of Missouri than the current 5 days a week of 2 hours of care, as I used as an example? So a lot of concerns and a lot of things that will be negotiated over the next week with regard to the budget. We are constitutionally mandated, as I've said before, to have that budget done by May 5th and sent back to the governor's desk for his review and consideration. I think that we're going to be able to get that done, but this week will bring some interesting discussions as conferees from the Senate and the House meet to reconcile the differences between the House's version and the Senate's version of the budget. From there, I wanted to talk to you about, first of all, I wanted to thank those of you who have taken time to send in your surveys back to the district. We will be posting online as we continue tabulating. It's a big job to get these tabulated. We've gotten about 2,500 responses that we have tabulated thus far. And one of the areas that I thought was of particular importance based on what's going on in the House and in the Senate and in the governor's office was the area around campaign finance transparency. The question you were asked is it important to you to know who is funding political candidates and campaigns? 93% of you, or 2,318 of you who answered that question, said yes. 6% said no, and 1% was unsure. I went further and asked you, would you support legislation that enforces campaign transparency by requiring candidates to disclose sources of donations to political campaigns? This, again, got 93% support. Out of the total number of people answering that question, we had 2,296 that said yes, 5% or 124 people that said no, and 2% or 51 that were unsure. So overwhelmingly at 93%, you said you want to know who's funding political campaigns and candidates, and you want to see legislation that requires transparency around these issues. So that has been the source of a lot of controversy here in Jefferson City, and I've talked about this before too. As you know, the governor has $1.9 million in his campaign that was sent to him through 501c4s who are not currently, by law, required to disclose who their donors are. So when there is almost $2 million there and we don't know where it comes from, it makes a lot of people concerned and suspect about who is pulling the strings and whose priorities may be getting taken care of here in Jefferson City. What you've heard over if you listen at all to the debate going on, is the senator from St. Joseph, Senator Schupp, really standing up and being concerned about the dark money in politics. You've also likely read or heard that the governor has established his own 501c4 here in Jefferson City, where he is able to accept money from unknown donors in order to use to, as he has said, put forward his agenda. So this is going to be very interesting. He has people working in the governor's mansion with him in policy. Some of those same people are also working with his 501c4 located not far from his office. So right there, I believe that there's a conflict. We don't mix policy with politics, and yet here are some dots that are easily connected. And then we know that when Senator Schupp started raising questions about the dark money, what happened in his district was that there were robocalls made and ads put out criticizing Senator Schupp, putting his personal cell phone number out there and telling people that he was violating ethics, rules, or norms. Senator Schupp, like all of us, rents a place here in Jefferson City when he is not at home in his district. I live, and I've told you this before, with 3 of my female colleagues right down the street in the first floor of a house behind the Supreme Court building. Senator Schupp happens to rent from a lobbyist. Many lobbyists who are here tend to own homes or apartments, and they rent out rooms to the people that are here half of the year. Many of us are legislators. Senator Schupp, it was pointed out on the floor by Senator Rowden of Boone County that Senator Schupp was renting his apartment from a lobbyist, and perhaps that would influence Senator Schupp's work on the floor. When he was called out for this, Senator Schupp went home over a weekend to reflect about that, and that was last weekend. Senator Schupp came back and made a very eloquent statement on the floor about the fact that he had thought long and hard about the perception of corruption or impropriety, regardless of the fact that he did not believe he personally was doing the bidding of the lobbyist whom he rented from. But he said, you know what? I thought long and hard. I am removing the speck in my eye, and I have told the person I rent from, the lobbyist, that I will no longer be staying at his place. He, that very night, began staying in a hotel. He said to the governor, Governor, I have removed the speck from my eye. Now I think it's time for you to remove the log from your eye. And by that, what he's talking about is the hiding of the dark money, the establishing of a 501c4 to put forward his agenda, which we know was behind the robocalls and ads that went into Senator Schupp's district to discredit him. And this battle is going on. So Senator Schupp talked about that at the beginning of the week and then said this: I am not going to stand in the way of our constitutional duty to pass a budget. I am going to stand down and let us move forward on the passage of this budget. So we spent, today was the third day that we did work on the Senate's version of the budget, and we're done with the portion that we need to get done before it goes to conference. So Senator Schupp stepped down. We all worked on the different parts of the budget. We offered amendments on areas that we thought were important. But it will be interesting to see what happens in the next 2 weeks of the legislative session. Again, we have one more step in the budget process after the conferees meet. But then we'll see if Senator Schupp is intent on what he says he wants to do, which is to ensure that ethics reform gets paid attention to in this legislative session and perhaps even moves forward. Now, many of you have heard about the concern over lobbyist gifts or the concern over the revolving door where people who work in the legislature immediately become lobbyists once they leave these chambers. But now you will hear more and more about the idea of dark money and the establishment of 501c4s, which hide the donors' names that are associated with money going into campaigns. And as you may recall, I filed a bill about that dark money for the last couple of years because I believe it's so important for you to know who is funding the campaigns of those of us who are seeking your trust and your support. So we will see what happens there. Also today, we third read and finally passed in the Senate, Senate Bill 313. Senate Bill 313 is a two-part education bill that concerns me greatly. And I've talked to you about this before, so I'm going to go through some of the highlights or lowlights, as you may call them, in my view, and tell you why I both stood up on the floor today and continue to vote against this bill. First of all, the fact that this bill is designed to support kids with disabilities, kids in foster care, children of military families, that's a positive. We want to make sure that those kids get a quality education. But the reality is the way we go about it in this bill is absolutely wrong-headed. And really what this bill does is establish a voucher program in the state of Missouri, redirecting dollars from our public schools into other schools, including private schools, which by our Constitution we're not supposed to be able to do. So this bill, through a voucher scheme, through a tax credit scheme, takes an end run around that constitutional provision that say public taxpayer dollars do not go to educate kids in private schools. This bill does not put into place the accountability needed in those private schools that these students may attend so that we as a state can evaluate where our taxpayer dollars are going and whether we're meeting the needs of those kids who have very special and unique needs. One of the amendments I put forward on the floor was to say that these schools could not discriminate against people based on disability. That amendment was voted down, which is not only shocking, it's dismaying in light of the fact that we're asking these schools to take and to educate our kids with disabilities, and yet they're also at the same time allowed to discriminate against kids with disabilities, not required to provide them the services that they will need. There is also in the transfer portion of the bill a mandate to hold kids back if they are 2 years behind in reading. Now, while that might sound like a good idea to not just socially promote kids, when we don't know what an individual child's circumstances are, and when we don't know what impact not promoting that child will have on other aspects of that child's life, including his or her psyche or ability to move forward in the other areas in which he or she has a passion or an interest or a strength, what we're doing is saying the legislature knows better than our school districts and our teachers and our parents and our principals to make good decisions about what is in the best interest of the child for the short and long term. So those are a few of the reasons that I had to stand up and vote against Senate Bill 313. Finally, I want to end on, well, it's a positive note. My bill on suicide prevention for people in the mental health profession passed through the Senate today. Senate Bill 490 was passed. I think the vote was 31-2 in support to ensure that our people in practice that work with people who need mental health support, from psychologists to behavioral therapists to marriage and family therapists, will all get some kind of training to be able to identify the signs and symptoms of suicide so that when they run across people with these problems, they will know how to deal with them, where to refer them, how to get them the help that they need. And hopefully, if this bill is able to move through the House, we will put into place a change that will save some lives. Thank you so much for listening, and looking forward to reporting back to you next week.